So we'll get started now. I just want to say hello to everyone and thank you for attending this webinar. My name is Hannah. We want to let you know that we are recording this webinar so it can be made available online for those who are not able to attend the live version. And the link to the recording will be at the end of the slides of this presentation. Please send your responses to discussion questions throughout the webinar in the chat. You should have the ability to send chats directly to panelists or to all attendees. And we encourage sending it to everybody so we can have back and forth dialogue. Today's webinar is called Building Peer Support Programs for Wellbeing at UNC-Chapel Hill, presented by Peers for Progress at UNC Gillings School of Global Public Health and the UNC Mental Health Coalition. Next slide, please. The webinar is designed to do three things. First, to acquaint you with peer support, what it is, and how it may be helpful in university settings. Second, we want to provide an overview of key ingredients of peer support programs and how to establish them. This will give you an idea of what might entail developing a new program. And for those with experience with these kinds of things, it might just be enough to get you going. And finally, we want to get your ideas and prepare for continued program development, training, and activities with groups on campus next year. So we really appreciate any feedback or input. Here we have the webinar agenda. We're in introductions right now, and we'll move through what is people helping people, talk about some interview findings, support skills and rules of thumb, training resources, and looking to the future. And we'll do a brief closing, and then that will move into optional extended discussion time, which will begin at 6 p.m. Eastern time. If anyone is free and available, we really encourage attending so we can have continued discussion. Next slide, please. So we'd like to just briefly introduce ourselves, the panelists, and I'll go ahead and start with you, Ed.
Sure. My name is Ed Fisher, and I'm a professor in the School of Public Health, and I have the privilege of leading Peers for Progress and working with all of the other panelists in the Peers for Progress group. It's good to have you all here this evening.
Hi, everyone. My name is Patrick Tang. I'm a program manager at Peers for Progress and also a graduate of the MPH program in health behavior.
Oh, Samantha, you muted.
Sorry, y'all, I was muted. So I'm Samantha. I work on the Peers for Progress team, working on program development. And I went to UNC for both my undergraduate and graduate degrees. And I'm really excited to see peer support blossom on our campus.
Wonderful. Can we go to the next slide? Emma?
Hi, everyone. My name is Emma Caponegro. I'm an undergraduate student who's graduating this May, and I've been involved in a lot of mental health advocacy efforts through student government, and I currently lead the Mental Health Coalition.
And again, I'm Hannah. I'm a first-year MPH student in the concentration of health behavior, and I'm a research assistant for Ed and for Peers for Progress looking at campus mental health. Now I'm going to hand it over to Ed, and he's going to begin by introducing the concept of people helping people.
Great. Thanks, Hannah. It's wonderful to be talking with you this evening and to help you understand what people helping people peer support programs can be on university campuses and get some ideas about how you might employ these kinds of programs in your work and develop or improve programs that you're involved with. Next slide. There are a lot of varieties of people helping people, of peer support, and that's a key point that we want to make. There are many ways of doing this. Number one here is a trained community health worker working with people with diabetes. Number three is grandmothers recruited in Zimbabwe to do problem solving on what they call friendship benches in communities there. You're all familiar with number 6, Alcoholics Anonymous. It's been around for almost 100 years. And in Durham, there's the Sisters Network, number 4, of African American women who have breast cancer and get together and support each other. So there are a lot of ways that peer support gets done and that it can be done on campuses. Next slide. This just briefly illustrates the growth of research on peer support over the last 15 years or so. So clearly peer support is something that people are thinking about and working on, and more to come for sure from peer support. Next slide. Now, as a professor, I would love to go through each of these slides in detail with you, exploring the evidence base for peer support. But Samantha and Hannah told me I could not do that. So I'll just summarize briefly. It works. Thank you. So there are a variety of ways that peer support can take place on university campuses. Emma and her colleagues, she'll tell you a bit about this later. A group of students have trained to lead a group peer support program in conjunction with CAPS. Resident advisors are often sources of peer support. We hope they are. Groups with shared common interests like LGBTQ folks, folks with common ethnic concerns, folks concerned about sexual violence. Clubs, teams, and other activities and sororities and fraternities can be important sources of peer support. Groups promoting stigma-free understanding of mental health with a mission in mental health can be an important approach. Informal groups of students, you know, the history majors that get together once a month to have pizza and talk about all the problems with their faculty. The groups of early career faculty sharing concerns about promotion, or groups of students or faculty encouraging each other's writing. So there are many ways that peer support can take place in universities for students, faculty, and staff. Next. So there's been some research on peer support in universities. This review of general approaches to mental health interventions found in the second bullet here that peer support was among the interventions with greatest benefit. So we know that peer support can be really important here. Next slide. This was a study of a 6-session program led by trained students. They had 2 days of training and they had some supervision from a non-campus supervisor. They focused on self-care activities, behavior change, goal setting, self-soothing, and the participants in the program showed significant increases in well-being from the 6-session program led by the trained students. Next slide. And here's another approach to peer support in universities. Folks from McLean Hospital outside Boston trained a bunch of students across varied universities in Massachusetts. For example, 600 students in 2013 on varied skills for peer support. And as one example, at Worcester Polytech in Worcester, Massachusetts, about 10% of undergraduates ended up participating in support groups of about 15 to 18 students each. Next. Now, I want to share with you what we find to be helpful. We've emphasized the variety of peer support programs. So then there's the challenge of how do you make sense of these? What's the constant? What's the key ingredients? And we've identified what we call 5 key functions of peer support. We begin at the top of this diagram with just being there. Very important that before, after anything else, just being there is very important, very effective for lots of people. Assisting in daily management, we see that a lot with people where we have peer support programs for people with chronic diseases, helping them do the things they need to do every day. But that can also apply to students at universities, whether daily management is meeting my timeline for getting my dissertation done, or whether it's getting my homeworks completed on time for organic chemistry or whatever. Assisting in daily management is important. Social and emotional support, we know that peers can be helpful in just helping folks stay motivated, looking on the bright side, seeing what their strengths are. And they can also provide help in coping with stressors. There are lots of stressors in being students and faculty and staff these days. And peer support can be helpful in coping with that. Linkage to clinical and community resources, learning what opportunities or resources there are on campus, whether it's clinical resources or resources for getting involved in activities. And then ongoing support is really important, because most of the problems that we have are not like an acute having a cold. They're things that tend to persist. And so ongoing support is helpful for people staying with the things they need to do. So with the next slide, I think I'm going to turn it over to Emma Caponegro, who is going to talk about some of the programs on campus for students. Emma?
Thanks, Ed. So there are a number of resources on campus with various types of support for students. Most of the peer support that I know of is student-led, but programs such as those on this slide are affiliated with the university. And on the next slide, you'll see that some formal peer support programs exist at UNC. Last semester, I was involved in developing a peer support program in conjunction with CAPS, the School of Social Work, and some other student groups. This peer-based support network promotes emotional and mental well-being in a safe, confidential, and accessible environment through weekly group meetings facilitated by peers. Additionally, I'm participating in a capstone group with Health Policy and Management to develop an acute peer support network for students reintegrating into school following an encounter with the hospital for a mental health reason, and we're hoping to launch it next semester. And on the next slide, with over 800 campus organizations, there are lots of sources of informal peer support, which is why one thing we want to do in the coming year is provide assistance to these groups as they try to develop their own programs. And with that, I'll pass it off to Hannah to talk about interview findings and feedback.
Great, thank you, Emma. So as a research assistant this past semester, looking at campus mental health, I've been interviewing different groups and individuals on UNC's campus who are either directly or indirectly involved in peer support efforts, kind of like what Emma was mentioning. Could you go to the next slide, Samantha? Thank you. I'm going to go through some of these findings of the interviews, including strengths and challenges, desired education and resources, and intended future goals. At the end, I'll ask for some feedback from today's attendees on areas I may have missed in these findings, and so you can keep that in mind. So when we get to the end, if you have any thoughts, please put them in the chat, or you can put them in right away. Like Emma said, there are both formal and informal groups facilitating peer support on campus. I've spoken to a number of formal peer support groups whose approach to peer support has ranged from motivational coaching to weekly support groups to online peer support. And these groups had some overlapping challenges and successes, which I'll touch upon next. Looking at informal peer support programs, they mainly operate with weekly or bi-weekly group meetings. And they offer bigger educational or advocacy-based events throughout the year. Many of these groups and the individuals I interviewed that don't fall into either category express a desire to expand peer support services on campus. That was kind of an encompassing finding. And next slide. So people identified barriers and strengths within programming that currently exists. And among the barriers I'd like to highlight, there's been difficulty with participation, retention and recruitment into programs, and also difficulty standing out to students, possibly due to message fatigue. These two challenges, in my opinion, seem to go together, go hand in hand to sort of creating a barrier to successful peer programming and recruitment. And among the strengths, I'd like to highlight that many groups had consistent member participation in weekly meetings, and groups already felt a sense of connection to each other through their ability to learn and collaborate at the Mental Health Coalition. So we're really grateful that that exists. Next slide. When asked about desired education and resources, people's answers fell into three categories of skills enhancements with program improvement and coordination, coordination and communication as a whole, and campus-oriented improvements. And looking at skills enhancement, people expressed a desire to view and learn from accessible examples of peer support curricula. I think that helps to visualize what exactly a program could look like, and to enhance their skills to reach vulnerable groups on campus without creating or perpetuating stigma upon these groups. Lastly, they expressed they would like to be able to better explain the benefits of peer support to participants, which hopefully this webinar is able to help with. Within coordination and communication, people wanted to know about campus resources, have knowledge and awareness of those, which we'll touch on briefly in this webinar. And luckily, we may already know that there's some online, there's a website being developed that will centralize a lot of these resources so they're accessible to everyone. So that's some good news there. Next slide. And when asked about future program goals, people expressed that they plan to continue to grow group participation and want to see the breadth of peer support programs on campus continue to grow. So that's good news. People were also working toward increasing collaboration with other campus groups within the counseling center and even to universities beyond UNC's campus. People hope to develop peer support programs and initiatives in order to provide tools to students in the realm of practicing positivity, problem solving, and building self-esteem. Next slide. And now I'd like to take a moment to ask today's participants to provide me feedback in the chat about any points I might have missed or your thoughts on how we can use these findings when starting a new program. And we can go back to other slides if you'd like to read some more, because I know that was a little bit fast. But we'll give a couple seconds. Please type any responses into either to panelists or to everyone in the meeting.
So Nikhil Rao has asked, is there any way to send out a link to the presentation in the chat so we may view it as we formulate questions?
Yes, I believe we have Google Slides, so I can send out the Google Slides. Just one moment. All right. You should have the link in the slide or in the chat now to the slides. Samantha, could we go back 2 slides? So while we're waiting, I think this is one of the longer lists, so it might be helpful to look at some of these examples. Skills is something we'll talk about today, and we'll have links to peer support curricula. Oh, it looks like we have some chats. Lisa is asking, what is your sense of need for or effectiveness of peer support for a time-limited period / experience such as during COVID-19? That's a really good question, Lisa. Yeah, go ahead, Ed.
Yeah, I would say that clearly the need is substantial during this period, but we're hoping to help people at the university develop support groups among students and faculty and staff, so that nobody feels that they don't have somebody to turn to if they're really stuck in a jam or feeling really highly stressed out. And if we do that, and if it's effective for COVID-19, I think it may be an approach that we might want to carry over into more normal times, because as you all know, there are lots of stressors and concerns around these issues among students and faculty at the university in general. Suzanne, go ahead.
Yeah, Suzanne asks, who provides training to the peer support volunteers? What does this training entail?
So you'll be talking about that a little bit later on, Hannah and Samantha. And Peers for Progress is happy to work with schools and groups on campus to address needs for training.
Thank you for your question, Suzanne.
Yes.
And Yesenia writes, we are finding that students are not engaging with wellness/peer support groups as much as we anticipated during this time. That definitely touches on the recruitment and retention piece. How do you get students to participate? Oftentimes they don't realize they are in need unless they are in crisis mode. That's a really good question.
So one of the things that we've been doing in our department in public health is encouraging more informal groups of people who talk with each other anyway, but to help them be organized so that they can provide each other support if they get into really tough times. For instance, if somebody's parent or grandparent or brother or sister gets really seriously ill.
And Nikhil asks, as a follow-up question to Lisa, from what we've seen in peer support during COVID-19, what are possible takeaways from how we've shifted peer support during this time to extend past primarily virtual engagement with one another? That's a really good point. COVID-19 obviously is really relevant. I think as someone who's been sort of doing research by interviewing people, this is something I've been thinking about a lot. How what we do now is going to inform what we do later in terms of having accessible pieces of peer support available online at all times or integrated into programs. But does anybody have thoughts on that question besides me? I think
I'll just chime in really quickly. One of the things that you can think about with recruitment and retention, but also during this time when it's really difficult and maybe getting the support that people need is not on the front of mind, when maybe they're dealing with other more pressing needs like housing or transportation or healthcare, is to think about different ways of delivering your peer support. I think often we think about having programs where people are physically or virtually present at the same time, so synchronous support. But if you think outside of the synchronous support and thinking about asynchronous support, so having like text groups, that's one of the things that Ed mentioned that we're promoting now, is this idea of pods where people can text each other or leave messages and have ways to reach out and have a peer supporter know that, you know, someone is not responding so much, so they personally reach out to that person and try to engage with them if they notice a change in behavior.
That's a great point, Samantha. Thank you. At this point, we'll give some more time for thought. If you want to look at the slides, they should be available for viewing in that link sent in the chat. But we'll move forward to have Pat discuss some skills and some rules of thumb for peer support programs next.
All right, thank you, Hannah. So, you know, in all the experience of Peers for Progress, we worked with a lot of organizations and peer support programs, and we've tried to distill a lot of these lessons and what we see as important support skills that peers should have, and also just some of the principles and good practices that we've seen in these other programs. We could spend a whole half day on this, but just to give you a little overview of what we feel is important. Next slide, please. So I'll start off with some of the guiding principles that I think both the program developers and supervisors all the way down to the peers themselves need to get on board with. So the first thing is just to understand that a peer supporter's effectiveness doesn't come from being an expert. So we shouldn't expect them to be topic experts. They don't have to, be a mental health counselor and know about diagnoses and know everything there is to know about treatments and things like that. Their effectiveness comes from their shared lived experience. And to continue on that thought, peer supporters do not provide medical advice. They can definitely provide guidance and suggestions, but when it starts crossing that boundary into the medical advice, that's where they have to recognize that that's going beyond their scope of practice. Skip down to number 4 here. The understanding that people are capable of solving their own problems, and the role of the peer is to help those individuals find the solutions, not to solve problems for them. And lastly, just something that we like to train peers on is that they don't have to always know what the right thing to say is. So a lot of times they might encounter participants, clients who are in various stages of distress, might have very complex problems, and sometimes it's just about staying silent and being a good listener versus knowing what the exact right thing to say is to either cheer that person up or to give them a solution or to help them solve a problem. Next slide, please. In terms of the ethics, this is something that we include in all of our trainings to make sure that our peers respect boundaries, so they maintain boundaries. They respect participant choice and control, also protecting privacy, and lastly, and most importantly, I think, ensuring both participant and peer safety. So for some of the participants in here in the room right now, maintaining confidentiality and privacy is really important, especially for students. So both privacy of healthcare information, that's HIPAA, as well as privacy around educational information, which is FERPA. And I think one of the other important points on this ethics slide is that it should be understood upfront when participants, start joining a program, that there is a duty for the peer supporter to report actual or potential harm to the participants if they see that type of a risk. And that's why it's really important for peer support programs to have some sort of clinical or professional backup in case those situations do arise. Next slide, please. In terms of basic competencies that we want all the peers to have, a lot of these are qualities that they might already be coming into a program with. So their ability to rapidly build support, rapport, and trust with their participants, and a lot of that comes down to how authentic they are and how open they are to building that relationship. Like Ed said before, the importance of being there, so being available, being reliable, picking up the phone and at midnight or 2 in the morning, or answering a text within a day. That's really important for people to have that sense of security that you're there for them. Really important that the peers demonstrate empathy for their participants. And, a lot of times these people that participate, they just want someone on their side, right? Someone that understands them and isn't always lecturing them. They just want someone to be on their side. And I'll just end this with the 4th point here: keep context light and non-demanding. I think we can all think of an example where, we could have prevented an argument from happening if we just started off a conversation by saying, are you just venting or do you actually want some advice? And, that can really help you frame a conversation or actually, no, sorry, that's the point for show sensitivity and good judgment, knowing when to push and when to back off and knowing if someone's just venting. Next slide, please. So this short list of 5 important skills that peers can expect to use every day, starting off with active listening as a key component of motivational interviewing. You all might know that, the full training for motivational interview can be like 2 days, I think minimum of 2 days. But how do we distill that into something that's more feasible to train students and non people who aren't looking to be certified on. Storytelling, strategic disclosure, so that's part of being open and telling your own story, establishing that shared lived experience. And I think a core component of peer support is helping folks problem solve, like we mentioned earlier, helping people find their own solutions to problems. And the last bullet point here, that connection to referrals and then following up after people use services and making sure that they go ahead and use those services. Next slide, please. I think one of the key lessons that we've learned is that a lot of programs emphasize that initial training and they pack a lot of stuff into the first week or so of training. But a lot of people that want to be peers, they might get overwhelmed with that. And also they don't know what skills are important to them until they actually start doing that kind of work. So we always feel that the supervision, the monitoring, and the backup, once they're kind of out there doing that kind of work is often more valuable than the initial trainings. Next slide, please. And so just to summarize some of these keys to success, listening skills are really important. Asking, part of active listening is being able to ask open-ended questions. Noticing when participants are experiencing distress and making that referral when there is potential harm. Following up and doing those kind of low-demand check-ins. Leaning on your other peers and also on the supervisor if you're unsure about anything that might be outside your scope of practice. And then lastly, just remembering that it's just about availability and being there. That's one of the most important things. Next slide, please. And I'll just end it by asking the question, what is the most valuable resource in a peer support program? And, some people might say, is it the funding? Is it the organizational support, the leadership? But, I think oftentimes, all the time, it's the peers, it's the folks who are working with the participants and all of the strengths and insights that they bring into the program. And I'll hand it off to Hannah for the next session.
Well, actually, Pat, we're going to stop for a few minutes and offer people a chance to ask questions. I just want to pick up where you left off there, the peers and the strengths they bring. We mentioned that earlier and the importance of being there. And I think time and again, in working with people, they tend sometimes to get too concerned about having the right answer, being able to give people all the information they might need, and lose track that their greatest strength is just being there for people, just being someone who's accepting and willing to talk and not make a lot of demands. We do have a couple questions from Colleen. How do you ensure the peer supporters have the basic competencies and skills that peers use every day? Are these the qualities you look for in the peer supporters when you select, or are these taught in training? What is the format for your training? It seems as if you do not do a one-day training. Would you elaborate? Pat, you want to take a crack at that? And I may
Sure.
also.
Yeah, that's a great question. So we often tailor our trainings to the specific needs and the constraints of an organization and what's feasible for their group of peers. So we've done trainings from as short as like a half day to 2 days with ongoing trainings after that, like 2 full days. And if you really want to do the interactive role playing and discussion and to really get into all those skills, it can really take a long time. But one of the things that we heard from some colleagues in social work was that some of their trainings, they were able to do everything they wanted to within 3 to 4 hours of training. In terms of some of the qualities that we're looking for, it is true, some of the kind of emotional intelligence things, those are kind of things that you want to assess when you're recruiting them and you're doing maybe that interview to see if they would be a good peer. And you kind of have to assess that. And throughout the training as well, see how well they're taking to some of those skills. And if they're picking those things up. I think one of the things that we've learned from our programs is that really the only thing that it can be a problem is folks that are too bossy. That's something that's hard to untrain people to do, but a lot of the other stuff you can definitely train them to do.
And I would just add, to go back, Pat mentioned that, we believe increasingly that as important as the training is the ongoing supervision and enrichment. And that can go on within the program, getting the peers together to exchange notes, talk about problems and things they faced, talk about things they found helpful. They learn a lot from each other, and it's very focused on the circumstances that they're working with. But also programs can learn from each other, and we're going to talk to you a little bit later about possibility of establishing a collaborative learning network next year, not next week. Lord knows we're not doing much of anything next week, but a collaborative learning network that will facilitate programs learning from each other. Pat, we had another question from Lisa Warren. Can you say more about Principle 4, learn as much as possible about issues that affect participants? Does that mean get to know what's going on with the participants, or get you to know the shared issues that may be causing distress?
Yeah, I think that is really asking questions to learn about some of the maybe issues that might be hidden even to the participants, or maybe some of the social determinants of health issues that might be affecting them. So really getting to understand the backstory and those types of things about the participants.
It's never a bad idea to ask another question, to be open to hearing a little bit more from someone before you start talking about things they might do.
Yeah, and always, I think part of the active listening is just to repeat what you're hearing, just to make sure that you've understood that person correctly, instead of assuming that you've kind of understood what they're trying to say, and that's part of getting to know those issues.
But you're right, Lisa. Peer support is essentially person-centered. It's about learning what their problems are, not what the book told you they are. So I think we can go forward. Next is Hannah talking about resources.
Apologize, I was muted. Moving forward, we want to kind of build off of exactly what we're talking about, which is skill building. Skill building for providing peer support begins with acknowledging your individual strengths as a peer supporter. Next slide, please. So we want to look at what we bring to the table. First off, be yourself. You don't need to be a licensed therapist, like Pat said, to provide peer support. Being yourself is good enough. Secondly, using your expertise. You can apply what you've learned through coursework, volunteering, and working to recognize where your skills lie. If you're someone in public health, someone in social work, someone in psychology, we all bring different skills to the table, but they're all valid and useful. And third, give your time if you're available, of course. Be giving of others with your time, and you're going to create an environment of support as a response to that. Next slide. So we should keep those in mind, but we also know that sometimes we want to sort of enhance our knowledge, enhance our skills with available trainings. On the slide, there are icons for many sort of issue-specific trainings, and most of these are on campus, and including ones that you've heard of, like Haven, which focuses on developing the skills to be an ally to someone who has experienced sexual or interpersonal relationship violence or stalking. Mental health first aid, which is a training that gives students, staff, and faculty the skills to help someone who is dealing with a mental health problem or experiencing a mental health crisis. And Safe Zone, which is a training designed to introduce concepts, terminology, and resources related to sexual orientation, gender identity, and gender expression. So depending on the specific areas you'd like to build skills and what community of peers you are looking at to support these trainings, and others that aren't included on this slide can be used to build expertise. But I'd like to turn the attention to the chat for a moment to ask participants to type in any helpful resources or trainings that they would like to share with the group. If there's one that's not listed here that you think has been really helpful, or an area where you want a training to be developed that isn't there. I can say Peers for Progress is possibly going to be doing an abridged peer support training coming forward as a part of the COVID-19 response. So that's something that could be upcoming. But if anyone wants to share any good experiences with training that they have, we'd love to hear it. I'll give a moment for that. I know personally I've done the Haven training and I thought it was great. And looking forward to doing some other trainings which may or may not be on pause right now given not being on campus. But
Yeah, I did the Safe Zone training when I was in my master's program. Emma says, Safe Zone training for how to be an ally of the LGBTQ plus ally has multiple trainings for more specific groups, specifically healthcare, once you do the main training.
oh, that's really interesting. So you can sort of build off of trainings there, which is nice.
And Suzanne Harris shares, our third-year students at the pharmacy school complete the mental health first aid training. That's great. They're now offering a shorter version, which is great. Chrisanna Hughes, oh wow, we're getting he's coming in so fast. We'll hopefully be offering a virtual Safe Zone training at Gillings in late April.
Oh, that's great.
Yeah, this is such a great opportunity to develop these virtual trainings that will, be there for after this period is over, and we'll just have these great resources online. That's great. Lisa Warren says, not sure if these are available now locally, but in the past I did training with La Leche League and also with chronic disease self-management, diabetes self-management. Might want to hear more about La Leche League. I guess that's the sugar?
No, it's for breastfeeding.
Breastfeeding. Sorry. Colleen says, would love to see the university offer an emotional intelligence program. I completed one and it's really useful.
That would be really interesting.
Yeah, I'd like to hear more about that as well. Colleen, would you mind sharing where you might have completed that and where we might learn more about that? Claire shares Behind Happy Faces. I don't know much about it other than as part of my sorority's required continuing education focuses on starting conversations around mental health. It's very beneficial.
Wow.
That's great.
Yeah.
And Student Senate at the pharmacy school hosted it as the culminating activity. Oh, this is going back and referring to the emotional intelligence program.
Yeah. I think the lesson is there are a lot of things out there, but there's also opportunities to create new trainings. So yeah, depending on what you're looking for, there's opportunities for collaboration or attending one of these trainings, hopefully now even online. That's really exciting to hear that. But I'll turn it over to Samantha, looking towards the future. And if you have more chats, feel free to keep adding them. We can all read them and touch on them at the end as well.
Super. So really quickly, I just want to speak a little bit to the ideas of program management and program development when you're thinking about creating or developing your peer support program, or even if you already have one, what you might think about when you are thinking about reflections or improvements or expansion. So first, on the topic of program development, on the left side of the slide here, I've just got some key responsibilities and tasks you want to think about. I think the big thing is engaging your stakeholders after you've identified them, of course, and figured out who you're trying to support, who your peer supporters are, and if there's any other leadership that you need to engage, asking them, what do they really want out of a program? What would be most beneficial to them? But then the people who might be your peer supporters, what kind of training do they want? What would help them feel prepared to be a peer supporter? And then also taking those trainings that were just mentioned, or if you see a program guide that someone else has shared, and really tailoring some of those tools to be appropriate for your audience. On the right-hand side, I've got a few resources here for program development. Both ourselves, Peers for Progress, and Johns Hopkins has program development guides that are available for free online. The links there are live. And then also there's an equity and mental health framework that's specifically targeted towards university and college settings. And that's really neat if you check that out. When I'm thinking about program development, everyone knows SMART goals already, but I feel like SWOT analyses kind of fly under the radar. So I just wanted to share this kind of framework for you all if you haven't heard it already. But when you're developing your program, it's really useful to think about what those strengths that your program would bring, what the strengths of your future staff or volunteers or leadership would bring to the table, as well as what weaknesses and things you could work on. What are some opportunities that you all have, and also what are some threats? I like this figure. It kind of helps you organize all your different thoughts, definitely write them down, and kind of analyze and continue to reflect on what these points are, because they can also change for you. One example I want to give is when we were developing a program, we thought about threats and how they might be harmful to achieving our objective, which was to provide peer support to cancer patients and their caregivers, and they were coming externally. It wasn't that the people who were threats were from the people within the program themselves. Actually, the one perceived threat that we had was the clinicians. We thought, well, they might not like us talking to the patients or having peer supporters, lay people talk to their patients. And so actually, once we explored that a bit more during the program development, we actually talked to the clinicians, the people that we thought might be a threat to the program success, and asked, you know, what do you think? What information do you need that would make you supportive of this initiative? And that led us to develop some materials that you see screenshots of here. So that really got clinicians to be educated about what we were doing. And I think that in a university setting, you could see this, for example, with administrators who might be a bit wary of a program, or even with other students who might not understand what is peer support and why would it be helpful for me. And you can turn that threat into an opportunity. So we were able to leverage that and get the clinicians on our side as a source for potential referrals. So once you have a program designed, you might think about program management, and don't get scared off. This is a lot of responsibilities, but it can be spread out over a few different people. A student group leadership team is what I'm imagining in my head, or a couple different staff members. But I highlighted a couple points here at the bottom. I know Pat talked about earlier this idea of coordinating backup and supervision and leading check-ins as being really important, and equally important as the initial training that you might give your peer supporters. That's a responsibility that may fall on a program manager. And then the last point, which is continuous quality improvement. As a program manager, when you get to have those check-ins with your peer supporters, that's a great opportunity for you to be gathering feedback from the peer supporters, and to see, you know, what do they like about the program, what do the people that they're supporting like about the program, and also what do they think could be better. And that feedback can really generate a lot of energy for your program from the peer supporters, and it makes them feel valued for you listening to them. But also it's a great way for you to improve your program and making sure that it's doing what it needs to be, and what it's set out to do. And lastly, I'm just going to finish on this idea of collaborative learning networks, which has been mentioned a couple times, but it's essentially what the name implies. It's an idea to facilitate cross-group collaboration. I think Ed mentioned it earlier. It's a space for sharing resources, lessons learned, backup, and even training. I know that a lot of the trainings that were mentioned in the past, they come and they talk to groups and do a private training for you, and you could have something where a lot of people, where multiple programs are coming together and attending a training together, and that way your discussions can be focused around your peer support programs and how you can adapt and implement and learn from it. It's also a great opportunity to connect with other institutions or community organizations and to learn from them. The whole idea being that you shouldn't be operating in a silo, and while you may be serving different populations, or your method may be a little bit different, you know, in person versus virtual, there's still lots of things that you can learn from each other, and this idea of a network creates a space for you to share that.
And I just add, Samantha, on that,
yes,
you know, I think we've been aware that there are lots of peer support activities at UNC. Emma mentioned 800 student organizations on campus. And of course, a lot more is emerging now with the threat of COVID-19. So we're very eager to work to develop a collaborative learning network over the summer and in the fall to help all the varied programs work together, learn from each other, share resources, etc. So more to come.
Great. And then when we originally designed this workshop to be in person, we wanted to have a lot of discussion and interaction. And these were some really big questions that we heard that people wanted to be able to discuss during this time. So I have them up here now, but we are going to move that into extended time. So keep these questions in mind. And back to Hannah.
Thank you, Samantha. We would really like to encourage that you stay for extended time if you're available, but we really appreciate you joining us today. This conversation is one that we really like to have and build upon for the future. But we have our contact information on this slide, so please reach out to us if you have any additional thoughts or questions. And the link on the bottom of the slide will have the recording of this webinar uploaded. If you're interested, there's also a recording on there from last Tuesday called how to be a supportive friend during COVID-19. I know COVID-19 has already come up a few times, which is also something we can talk about in an extended time, but it's on everybody's minds. And so if you're interested in that webinar, go ahead and use that link to access that. We'll give a couple minutes now to transition to extended discussion time. We can put those questions back up if you want to think about it, think about your answers. We'd be happy to go with those questions. I'll also answer questions that you still have that you can write up in the chat. But also, if you do not have time to participate in extended discussion time, then that's all right. We'll miss you, but we appreciate you attending so far. So maybe, Samantha, we can just leave, well, we can leave this up for about, oh yeah, we can go to discussion questions and have those there for you guys to think about. Looks like we got a comment from Nikhil. Thank you for hosting a great webinar, Peers for Progress. Thank you, Nikhil.
Thank you, Nikhil.
We're really glad you could attend and contribute to the conversation.
Nikhil has been Emma Caponegro's partner in crime this last year in developing the peer support program with the School of Social Work and CAPS.
Yeah, Nikhil has been very instrumental in starting the peer-based support network. So really appreciative that he could join today.
What other questions or comments do people have?
Claire mentioned that she'd love to see some sort of peer support form, advising, better advertising for peer support resources at first year orientation for students. It's a great idea.
Yeah.
Yeah, I agree that some type of resources for peer support at first year orientation would be great. I wonder who would be the best to provide that information, if it would be Peers for Progress or possibly a student group.
Yeah. I think we, certainly we could work with you, but I would think the Mental Health Coalition could do some work on that as well, Emma.
Yeah, that's a great idea.
And Suzanne Harris said, what about peer support with faculty and staff? We're trying to develop some peer support activities among faculty and staff in terms of establishing support groups in response to COVID-19. But I think more things along those lines would be really useful. And we have been talking for the last year about the importance of peer support and mental health being campus-wide issues and not just student issues. And I think that, the healthier the faculty and the staff are, that's good for the students' mental health and vice versa. So hopefully we can do more on that, Suzanne.
And Lisa added to Claire's comment about providing resources for peer support at orientation, saying it's also great for students at every grade level, including grad students. And as a grad student, I would also agree. That's a great idea. Right, so we still have 7 attendees. Oh, and so we can jump into any discussion questions that have on the slides. The first one would be, what programs would you like to see next year in your own groups or across campus, and how can you prepare for that now? Normal processes have been a little bit disrupted with COVID-19. So if anyone's been thinking about this or has ideas, we'd love to hear your thoughts.